We did have some positive news on a potential coronavirus vaccine. That's working its way into the investor mindset today. Oxford University and AstraZeneca with the early trials for a drug that produced a strong immune response. So that certainly has some people feeling optimistic about what the future might bring. And before we get to any kind of political negotiations over what the next stimulus might bring or what that might look like, let's talk about the medical side of all of this. Dr. Sudip Bose joins us now, emergency medicine specialist at the Medical Center Hospital in Odessa, Texas. Good to see you. And a couple of other topics that I'll get to you with, but let me start on the vaccine front. How optimistic should we be, do you think?
Hi, Connell. Thank you for having me. I'm optimistic. I know there are several groups working on vaccines right now, and it's like a road race, essentially, like who's going to come up with this first. And I think it's going to be a huge part of the solution here, but it's not going to be a panacea. It's not going to be that the vaccine fixes everything. I think the biggest thing that our listeners have control over is our own personal behaviors and how that can affect the spread of the virus. So I think it's a combination of a lot of things.
Right. Being careful where you go, keeping your distance. We've heard these things over and over, and, wear masks when you're out there. That said, Doctor, on the therapeutic side, before we get to the vaccines, we get news every now and again, like there was this UK respiratory drug company today, the stock was through the roof, and I guess they came up with something therapeutically. How are you guys doing in terms of how you treat the virus, especially in the time before we have a vaccine in place?
Sure. And what I'm seeing here in Texas is twofold. So first of all, there's freestanding emergency rooms, which are kind of separated from the hospital. Patients come in. My last shift in 10 hours, I saw 120 patients with the help of incredible nurses and techs and scribes. Some of them, we don't even get them out of the car. They're the walking well. Some of them test positive. And hopefully they don't need as much as far as therapeutics go. And then on the other end of the spectrum, when I work at Medical Center Hospital, which is a county hospital, we're seeing the sicker patients who need oxygen. And, unfortunately, we had one of our nurses pass recently too, or our employees, I should say, and we basically are a half-mast for that. So it's a spectrum between the walking well and the extremeness of sickness. So the therapeutics depend on which one you are. And for the listener out there, the unpredictable thing is where on the spectrum you'll be. So if you catch this, you can't say, oh, I'm going to be the walking well. I mean, we're seeing 20, 30-year-olds who are needing oxygen, and, we have patients in the ICU and our floors. So we have to be careful with this. And then from our end, we take care of the therapeutics individually based on where on the spectrum they are.
Yeah, I can see why you're going back to that personal responsibility side, and that we all, because you're right, you never know, that you have to just be careful on, with your own family and your own actions, and the things that you can control, you try to control them. I know you, I believe, worked in the military for some time. I saw that story that, things are so rough in California and Texas, and military medics are being sent in, right?
They are, and I think this is a great thing. I mean, first of all, I applaud our military. I know these doctors, nurses, medical professionals are very, very well trained, and whether it's a missile or a microbe, we can always count on our military.
Yes, we can. Doctor, thank you. Sudip Bose from the state of Texas. We'll continue to watch that and other states as these spikes continue to be reported.